Here is a section through the prostate gland. It's a gland in the male reproductive system, and immediately prior to ejaculation, the prostate gland is going to contract and offer its prostatic secretions into the seminal fluid. Well, to contract, it needs muscle contracting within the gland itself. And if you look into this image, you can see some epithelial cells that are making the secretory product, but you'll also see yellow stained smooth muscle cells supported by collagen or connective tissue, which stains a pinky red. And that stain is brought about using a Van Gieson staining technique. Here's a marvellous image. The Van Gieson staining technique is probably better shown in this inset image. What you see on the bulk of this image is yellow stained skeletal muscle, enclosed by little fine strips of coverings of red stained collagen or connective tissue. And the stained connective tissue elements divide these skeletal muscle fibers into muscle bundles or fascicles. You'll learn about this when you do muscle tissue in more detail. But here you can see a transverse section through the wall of a small artery, again stained yellow because the wall of this artery is predominantly smooth muscle. So muscle, whether it's smooth or skeletal muscle, stains similarly. But what's important is that you can tell the difference between the muscle around the wall of this blood vessel and collagen which supports the blood vessel. And that particular collagen is showing up in that red stained component you see in this particular image. So it's another example, like we saw earlier, with the trichrome stain distinguishing muscle from collagen. And they are two tissues that are often very hard to distinguish in normal hematoxylin and eosin stained sections. And that makes histology sometimes difficult to learn if you don't have the use of sometimes using these differential stains.